My name is Pia Visaria, and today I'm going to be presenting on the clean water crisis and its impact on global health. A little bit about me is that I'm a rising high school senior from Princeton, New Jersey. I'm very passionate about environmental advocacy and policy work, and I plan on studying public health in the future. Access to clean water is a fundamental human right, but unfortunately, so many across the world are denied this access. And it disproportionately impacts people from lower income and underdeveloped regions. But access to clean water goes so much beyond the basic drinking and agricultural necessities. It serves as the root cause and is heavily interconnected with the following three pillars: disease transmission, development, and nutrition rates. Each of these three pillars and their connection to the clean water crisis is something that I'm going to go deeper into in this presentation. But on a more personal note, I chose this topic because of my family background. I'm native to the area of Kutch in India, which is a desert on the border of India and Pakistan. And the water crisis has been a devastating issue in this region, and in recent years, the economic repercussions due to agricultural instabilities have become all the more prevalent and are truly taking a toll on the daily lives of the people who live there. But Kutch is just one such area and happens to hit home hard for me. Thousands of communities across the world, such as Flint, Michigan, a community that is disproportionately low income, African American, and Hispanic, is suffering through lead that is contaminating their tap water. This is not only leading to an inconvenience with not having water to drink on a daily basis, but also neurological impediments in the children and youth of this community. Similarly, Navajo Nation, an indigenous community in the American Southwest, is suffering in arid conditions because there isn't enough water infrastructure to support the reservation or proper irrigation. The first pillar is disease transmission and clean water and their connection. Globally, at least 2 billion people use a drinking water source that is contaminated with feces. Children are at the forefront of this, with diarrheal diseases that are caused by contaminated water claiming the lives of approximately 297,000 children under the age of 5 every year. Waterborne illnesses such as cholera, dysentery, and typhoid are those that thrive in environments with contaminated water sources. But there are proactive measures and solutions that can easily be taken to prevent these outbreaks from happening. Solutions such as increasing the amount of funding towards water infrastructure, increasing sanitation practices, and most importantly, hygiene education, and equipping the communities that don't have access to water with the right resources and skills to advocate for themselves. The second pillar is the connection between clean water and development from a global health perspective. We see that the three pillars within this are agricultural, educational, and economic development. Communities with reliable access to clean water can cultivate sustainable agriculture, which leads to increased food production and improved nutrition. This in turn leads to greater economic yields and helps these communities thrive and really unlock their full potential and be self-sufficient. Another component is the educational development and the literacy rates that are going to increase at exponential rate when communities are given access to clean water. Currently, in many regions, women and children are burdened with the responsibility of fetching water, often from distant sources, which is serving as a barrier and hindrance for them to receive an adequate education. However, clean water would alleviate disparities on all three levels: agricultural, educational, and economic. The last pillar is clean water and healthcare. Coming out of the COVID pandemic, we see that our healthcare providers are already extremely strained, and access to clean water would be taking a proactive measure and decreasing the strain on the healthcare system. Contaminated water can lead to children having stunted growth and their overall potential and development just being hindered. At its core, clean water is the foundational source for any community to thrive agriculturally, socially, and educationally. My work in this space involves water testing and sustainability education outreach events in my local community by interacting with youth and getting them hands on through water testing events at the local lake or the local marina. Through my work with Earth Echo International, for which I serve as a Water Challenge ambassador, over the last 2 years, I've been able to interact with many youth in my community and in New Jersey to help educate them and really help them develop into problem solvers and leaders who can be educated and aware to take on these crises. I truly believe that beyond federal funding and water infrastructure and other such major investment related projects, grassroots education and initiatives really have a true impact. And this work that I've carried out has had an impact in my community as we've become more aware holistically. Thank you for hearing me out. I just wanted to thank Earth Echo International for providing me with the right skills and resources to develop and lead change in my community, the Environmental Education Fund, for which I interned, which really taught me so much about the policy side of things in New Jersey, and of course, Heirs to Our Oceans, an organization that provided me with the opportunity to go to Washington, D.C. and express the youth perspective for the clean water crisis and other ocean conservation issues. Thank you for hearing me out, and I would appreciate if you reach out with any comments, questions, or concerns regarding this presentation to my email, which is pia.visaria@gmail.com, or you can find me at LinkedIn. Thank you.